Once they found the blockage, then they put a catheter in through an artery in the groin this morning, fed it up to the heart, put a balloon in and dilated the part of the artery that was closed and put a stent in, which is a very tiny thing. I'm going to show.
I'm so curious about what the stent actually looks like.
Well, I'm going to show
about it.
Yeah.
Sometimes we show animation, but you actually have one that you have permission to use
right.
outside of a procedure. So
well, because they want to, even though it's expensive, they want to show it off on TV. So a stent is really tiny and it's fed up into the artery, and you leave it in there and it keeps the artery open. So I'm going to open it.
How long can you leave it in there?
Well, it should stay in there for the rest of his life.
So would you have to replace it?
Hopefully not. Hopefully it will. After it lasts about 6 months, it should be good to go after that.
Okay, so this is a very typical device. Maybe obviously
we can show it here. This is the catheter.
It needs to be sanitized, so we at least know it's sanitized. How much does that device or that cost?
I'm gonna try to open it.
Do you do this in the operating room, doctor? Because that's
no teeth in the operating room.
We could have gotten you a pair of scissors. I mean, come on. We'll see if we can open it.
Well, maybe you can do it.
Yeah, let me try. Here, Liz, why don't I give it to you? While we're working on it, I'm going to have Liz, our stage manager, help us with it. But this goes in. It's supposed to stay in for the rest of your life. Is there any sort of, I don't want to say implications from this, but what does the president have to worry about from this point on?
Well, he's going to be back at work in the next few days, and he should have nothing to worry about from now on. But there is the risk of the stent clotting, so you use blood thinners. You use aspirin. You use a drug called Plavix. He's going to be on Plavix probably for a year. You use cholesterol-lowering drugs because we find that plaques form if you don't lower the cholesterol. So those are the big three. People that have had stents usually are on cholesterol-lowering drugs, aspirin, and Plavix. And then he should be able to resume normal activity. They'll keep monitoring him very, very closely. But there's over an 80% chance that this will stay open. I expect him to be mountain biking with me next year. Absolutely.
And as far as his release, when he could be out of the hospital?
He should be out of the hospital today. Usually they would not keep him overnight if he had it done this morning.
This is, by the way, I mean, at least we know that these stents are totally secure when they come to the hospital because we can barely get it open.
Okay, here it is.
But here it is, Doc. Okay, we only have a minute left, but at least it shows us a little bit about what it looks like. And we'll try to hold it up to the camera there. It is interesting to take a look at.
And you feed it right into the groin.
But it's very, 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 very small, Doc, right? It goes right into the arteries.
Very, very tiny.
All right.